And then in terms of the registration process for AHPRA visas, flights, moving personal belongings along, could you talk us through the process and of what you've gone through so far with this?
I think the first step was, again, we've done quite a bit of research as to how dentistry is, and we've recently just been on holiday in April to go visit Australia. So we did gather an idea as to how the process is and how to try to make it as smooth as we can. Plus, you yourself have been really helpful, letting us know as to what is the first step, how it goes, what order should we do it in, and how long it takes. So I think that's been really, really helpful as well. But the first step I would say was AHPRA. Is apart from if you don't get the application, you cannot really put in your applications for anything else, and you need to get registered with them first for you, as I said, to take any next step. But we were already told that the waiting times can be quite daunting to get the AHPRA registration sorted, so that's why we were advised to get that done first thing.
Yeah,
which we did.
AHPRA is a difficult one because we've got other friends who are not dentists, they are medics, and they've applied for AHPRA, and it can take up to 4 months, even though the website says 6 to 8 weeks. So, so basically, in my case, is that I think they're a bit short staffed, and I think the one thing to realize moving to Australia is that don't rely on the waiting time they give you on the website. Always call them directly to ask, or always apply early, because I had to from the UK to see their application. Again, it's pretty straightforward, but it's just
the waiting time. Yeah.
You need some time to just sort it out, just in case. But a bit lucky with ours didn't take that long, unfortunately. But as we said, we have heard stories that it has taken long.
It can go the other side.
Exactly.
Because then
thank you. That's really good. That's really good advice there. So I think dentists planning to make the move, this is a very important point, really. So thank you for that.
I think that was when we got the AHPRA registration, it felt like the first hurdle was passed, and it just felt a bit nicer because we knew that that's one thing that takes the longest. Once that came through, everything else that followed on did happen quite quickly. First one was visa itself. It did not take that long for us to get the visa sorted as well for the working holiday. So
that's good.
Quick process. But the only thing that we didn't realize then is the health checks that we need to do for the visas as well. So not every professional there for the working holiday visa needs the health check, but because we're in healthcare, we do need to get that done. So they wouldn't process the visas until you get that health check done, and until they send the results to them, and then it just took them 1 day to just process it.
Yeah, so the health check applies to the majority of type of visas, so the 482 and so on, and they can be quite expensive, and they're all done in private hospitals. So that's one more thing just to think of in case, because majority of clinicians moving to Australia need to complete that health check.
The other thing is private hospital does it as well. So firstly, it has to be private hospital. You can't get it done through the NHS. And with the private as well, I think it just depends who has got the contract to do these health checks for Australia. So we and the closest one that we had to ours was either in Edinburgh or in Manchester. And then we ended up going to the Edinburgh one, which didn't take long. We just had to call them and book an appointment. It was just like a day out, get it done. And they were actually very quick with it as well. They just processed everything, did the bloods, whatnot, said everything's fine, send them the thumbs up, and the day after we had visas done.
The visa is pretty straightforward.
That's good. And then I guess there's also the police checks, isn't it? The criminal check, history check as well.
That's another thing. I think because we had actually lived in the UK consistently for 10 years, it was straightforward. But if you lived in the UK and then your permanent home, let's say, was in Europe, it can be a lengthy process, because then you have to do the police check. We are different company for each country, which can take a long time. And I think that's one of the things that made your AHPRA come back really late, because yours took a bit of time.
Mine got delayed for some reason.
That makes sense.
It just depends on who's viewing it. So we ended up again. The best thing that we've done throughout this whole process is, if you think that there's something stopping, just follow up. Give them a call, give them an email. Everyone is really helpful. They will just tell you what's happening. If not, it just gives you a bit of reassurance that we've not got lost in the system or whatnot, and then it comes through. Plus, when you let them know that we're making this move, we need it a bit urgently because it's happening soon, they
most of all, we try to quite on it.
So
Yeah,
as soon as
That's
we
good
got
to know.
done, it didn't take long after that as well. But yeah.
but yeah, no, that was.
Sounds
And
good.
the
Mm.
provider number is something else. Obviously, the company we're moving with, they've been really helpful, and the practice manager has been fantastic. She's helped us
Mhm.
with the provider number and so on. She's even filled the application for us, and then we just had to put our name on it. So they've been really useful. But the provider number is
Really
not a big,
helpful.
but you won't be able to actually work without a provider number, and you need the
Mm.
AHPRA for. So I think I would say get the AHPRA done, and then once this is done, apply for the visa. And then after that,
Mhm.
then the number.
If
and so on,
anyone
yeah.
is wondering, is basically, so the AHPRA registration is the GDC equivalent to the UK, and the provider number
Yeah.
is NHS performance number. So you always have to get your GDC first, and then the NHS performance number. It's the same pattern follows here.
Okay.
But
Oh,
people
okay. Thank you for clarifying that. That's really good.
in the UK, they know that it can be a bit daunting. It can be a lot of paperwork, stuff like that. So
Yeah.
just getting started a bit early on, getting everything ready, knowing what you need, so it doesn't take that long when it's time to do it. I think that was the main one.
Yeah.
Yeah.
So you say the first step would be AHPRA, then the visas. So when would you then book your flights and all the other bits? Do you do that before or after all of this? Or what did you do? What was your process?
We wait for the visas to come through, just in case, because you never know, something might be wrong for any reason. We might not be able to go, or something comes up
Yeah.
in the health, not be able to go. Just a little bit of reassurance that we've got the visa, we can definitely go. We did consider booking our flights as soon as the AHPRA was through, thinking that let's book it a bit early so we can get the cheap flights, but
Yeah.
rather not risk it. And then we ended up just waiting for this to come through, and then that's when we booked the flight.
Excellent. That's good.
I think just because, there would be people that have never moved countries and they never have to apply for a long-term visa, but they can be very unpredictable in nature because you never know. Tiny mistake in the application can put it on hold for months and months. And I think Australia is very similar to the UK in a sense that everything needs to be sent via an email or needs to be sent through a post. So it can be a lengthy process. So if there's a mistake by the time they get back to you, it will be quite long. So, and I think the one mistake is to book your flight and then you don't have the visa and then you can't go and then you can't actually go to Australia even on a e-visa, like a visitor's visa, and then either because you have to be outside the country to apply for your first type of visa, long-term visa. And I think that's the one thing that stopped us booking the flights.
I think again, the chances you might think that are quite low that the visa might get rejected, but you never know.
But still, you just never know. There's always, a chance.
Yeah, because we've joined a lot of Facebook groups just of people moving to Australia, and there's a lot of people have, seen they've come across hurdles going to Australia for whatever reason. So I think
you don't want that to happen to you. It's already so much to do, really. You just want to make it go smooth, don't you?